everyone. So, I, Dr. Nitin Kumar Arora, would like to welcome you to the last part of today's discussion. So, today's discussion was, I believe, quite fruitful for you people as Dr. Kachi Vyas discussed about the role of virtual reality in anxiety management. And likewise, Dr. Karishma Chawla also, introduced virtual reality and artificial intelligence with you people and how these things scatter your day-to-day need in physical therapy. So these discussion topics very rightly justify the poster content that we had, that the technological aspects of physiotherapy practice. So because it is the evolving branch, and in the next couple of years you are gonna see this in each and every hospital, because this is the future. The future is all about technology. Have you ever experienced in the past couple of years if someone would have told you that you need to take classes online, you need to take these discussions online, give exams online, so you would have been saying, okay, this is just ruckus, it's not gonna happen anyhow. But now you see, I'm sitting here in India and you are maybe from US, Canada, Pakistan, Japan, China, Afghanistan, any part of the world, and we are together in the same frame. So this is what technology is all about, and this is what we are heading towards. So because everyone is heading towards technology, so is the physiotherapy field. So taking this continuum forward, as you got to know about the critical care, the pre-operative and post-operative anxiety management with virtual reality and technology, along with the artificial intelligence in tele-rehabilitation and orthopedic care. Now, I would be very willing to introduce you with a new domain, with a continuum of patients which are totally different from anyone you see. So, you might have seen a ortho patient, a cardio patient, a neuro patient. But when it comes to sports physical therapy, it's completely a different domain. I'm telling you, you won't believe that a sports person, even after getting injured, would be having more strength as compared to a normal healthy individual. Why? Because of the training demands. They train themselves so hard and up to the extreme of their capabilities. So whensoever one trains themselves to the maximum, they attain success. And in sporting performance, being a sports physical therapist, and as I have worked with a number of people, so I got to know that sporting performance is all about sports enhancement. So it's their performance enhancement, and at the same time injury prevention. So if anyhow you can improve their performance and reduce the risk of injury rather than curing it. We always learned from our very childhood that prevention is better than cure. Likewise in sports people as well. Whenever we talk about rehabilitation, we are talking about a sports person, an athlete who's injured. But why to always take care of an injured person? Rather, we should be looking at a person as a healthy individual in whom we should target everything in such a way that we remove the chances of injury happening or occurrence. So if we reduce the risk of injury, we are promoting better success in their sports, because we will be improving their performance, their skills, their techniques, their tactics, their everything. So because whenever you talk about fitness, you have health related fitness and skill related fitness. So health related as your speed, strength, and all those basic components, the endurance. And now when it comes to specific skill related component, there are power, coordination, time. Okay, so these variables which are complicated, which an athlete actually requires in their day-to-day life to tackle all the issues that are coming in their sporting performance, are what we call skill related fitness. Now what and how can we introduce technology in the field of sports physiotherapy? I would be making it that much easy so that anyone from BPT first year student to any level can understand what I'm trying to say, And still, if you feel any doubt, you can ask in the comment section down in the live chat which is going on, so that I can answer your questions hereby. So while talking about example of how can we introduce the thing, you might have heard of something called GPS. GPS means Global Positioning System. So GPS was introduced in the year 2000, and at that time it was something that was related to machinery and trucks, cars, buses. So a thing that is connected to satellite and taking signals and giving the signals back. So how do you get to know that your Ola or Uber cab or any other, there are many brands and many companies. So these cabs might have, so you book the cab is 5 minutes from your place, it's 10 minutes from your place. How do you get to know that thing? Because they have a common server and you have the particular app of that cab company, and the driver also has the same app. So both of you are connected to the same server. So now that satellite and the server gives the same information. So they detect how much distance is there between two of you. So the two ends, the driver and the commuter. So the commuter and driver has a particular distance. So the satellite measures a distance and tells you, okay, the driver is traveling at a speed of, let's say, 50 kilometers per hour. At this speed, and if the distance is, let's say, 10 kilometers, so he has to, so simple formula. So you can, deduce the time taken out of this velocity and distance. Okay. Now with this, the idea came into the mind of those brands which were making those GPS systems, that why not to make it a bit compact and introducing it into the sporting performance field. So what they made, you might have seen in games and all, that these sports person wear something called sports vest or sports bra. Irrespective of their gender, whether male or female, they wear that sports bra, and in that one they have a particular ball shaped structure, and in that ball shaped structure there are sensors that is put at the back side of the vest, right? And then the athlete performs daily activities, the daily training, the daily competition with that thing on. Now when the sports vest is on, now they are running, they are doing their activities, so that is connected to the satellite. So they have more than 17 satellites, so that is connected to them. And let's say, now how much is the accuracy and what does that measure? So talking about a GPS system, it helps to measure the distance covered by the athlete in a particular bout. Let's say it's a footballer. The footballer is running all the way around the field. If you might have read or seen a football match or read about one, you might have got to know that a footballer in a classical 90 minutes match runs about 20 to 25 kilometers. Can you believe me? So how did they get to know that in that short, small field or play court, they are running 25 kilometers? That's exhilarating. Now, how do you get to know about that thing? So it's a GPS system that tells you that yes, the athlete was here and he ran towards that side. So it calculates the distance, the displacement, the velocity, acceleration of the athlete, so how fast he was, how slow he was. Then deceleration, where he stopped, and that way. So there are more than 50 variables that they calculate and give you the data. Now how does that data people use, and how much is it accurate? Is it actually accurate? So they analyzed in that particular GPS system that an athlete who is wearing that sports vest with the GPS system on. So let's say there is a playground or play court of 1000 meters for example, and 1000 meters means 1 kilometer. Now 1 kilometer space is there and the person is walking or running, the individual, the sports person. Now the device or the GPS is that much accurate that it can detect even 2 centimeters movement in 1 kilometer space. So even if I move this much, so this was 10 centimeters, even if I move from here to here, it can detect that much of change as well. Just a minute change, you see the difference. That's 1000 meters, it's 2 centimeters. So it's so specific, so sensitive for small changes that it can easily detect. So that is why GPS is of immense use. And how does that actually get integrated into action? How do the coaches and physiotherapists take use of these data? So what happens is, let's say earlier, before the advent of GPS system and motion analysis system, so what used to happen, the athletes were being trained for strength, power, skill, everything. They were like, okay, an injury happened, train him. Injury is not there, train him for anything. But as the thing changed, so earlier they used to have one more thing. There used to be cameras. So let's say a cricket match is going on or a football match is going on. So what used to be there? They used to place cameras on individual athletes of importance. Like there are some athletes who are given more importance than others. Those who are performing very nicely, so they see how are they performing well. What are their weak points and the strong points. So that way, what they used to do, they used to make a video, and then after the match ends, the analyst or the video analyst used to watch that video completely and then give feedback to the coach and the physiotherapist that how did the injury happen, at which phase of the gait did the injury happen, what was the position of the lower limb and the upper limb when the injury happened, what was the athlete's perceived exertion at that time when the injury happened. But now the scenario changed, so it is not that much. So at that time it was so tiring, you watch the entire video of the 90 minutes match and you have to find each and every point at which anything happened that would have predilected to an injury. But now the scenario is the GPS system. It is detecting, okay, the time starts with the game. As the game starts, the time of the GPS starts. Now what happens is at 45 seconds, the athlete succumbed an injury. Now what happens is there is a change of acceleration. So earlier the athlete was accelerating and all of a sudden it decelerated because injury was there. So he stopped all of a sudden. So the GPS system will detect the change in velocity, that is deceleration, the decrease in velocity, and it will give a remark. Okay, at this point of time in the complete match, the athlete decelerated all of a sudden. There will be a sharp, graph decrease. So that means you can easily, very easily you can make out, okay, here there is a decrease. That means the athlete might have an increased chance of injury at this level. Now you can easily correlate that at 45 seconds the athlete decelerated and at the same time the injury happened. You can also see that what was the athlete's velocity just before the injury happened. So he was, let's say, moving at 25 kilometers per hour, so fast, and all of a sudden the injury happened. Now you can easily get that as soon as the athlete goes into that much of velocity range, the injury is bound to happen. So you'll train the athlete at that particular competition intensity, that is 25 kilometers per hour. You'll make him that much better that he can easily compete at that much intensity. Or else you'll see, okay, there are some sports in which, let's say, there's 100 meter sprinting. So 100 meter sprinters rely properly on their anaerobic systems because it is hardly a 10 to 12 second bout of running. And at the same time, if we talk about marathon runners, they have the other domain. So they are walking, they are running. Now when they are running, so what happens, they rely on their aerobic metabolism. So with the aerobic or anaerobic metabolism, their heart rate also changes. So the change in heart rate along with aerobic anaerobic metabolism you can easily get, because the GPS system placed at your back will easily detect what was the heart rate of the individual at the time of injury, the velocity, the distance he covered. So he might be fatigued at that time. So they might have been, if the heart rate was very high, so you might get, okay, the heart rate was high, that means he might have got fatigued, that might have led to injury. So you can easily, predict the cause and effect of the injury issues, the why it happened, so you can easily target that particular cause and you can get the results. So these were the main idea which you had to inculcate in your brains, that what GPS system is and how can we get a superficial idea about how it works in sports people, so that we can work further on it. If you people are interested to get more overview on this, you can let me know so that we can give you a more comprehensive video along with this one as well. So this discussion was all about giving you a superficial view of how it works in sports. So thank you so much for listening me, and stay connected, stay safe.